everybody, welcome back to another episode of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be talking about a mood-stabilizing medication known as Lithium. One of its brand names is Carbolith. Before we talk about the medication itself, just keep in mind that this channel is for information purposes only, and not to be used as a source of recommendations for your personal health care. Although the exact mechanism of action of lithium is not understood completely, it's thought that lithium may stabilize the catecholamine receptors. Also, it may alter calcium-mediated intracellular functions and increase GABA activity. There are a couple different indications of when lithium will be used, so we'll discuss some of those here for you now. It can be used in bipolar 1 or bipolar 2 disorder, whether that be for treatment or prophylaxis long term. It can be used to treat acute mania as well as mixed states. Lithium may be used to cause a decrease in suicidal behavior and has actually been shown to cause a decrease in suicidal rates. In terms of depression and OCD or obsessive compulsive disorder, lithium is thought to augment these types of medications that are used to treat these conditions. It can be used in individuals who have organic brain syndrome with secondary affect symptoms. If somebody has an affect component to their aggressive behavior, impulsivity, or antisocial behavior, lithium may be tried in these individuals as well. Lithium may ameliorate the restlessness as well as the excitement in 50% of schizophrenia patients. Lithium may reduce the amount that someone gambles when they're suffering from a pathological gambling disorder. And lastly, it is sometimes seen used in anorexia nervosa. Now, before somebody was to use lithium or Carbolith, there are some contraindications or precautions that they should clear or be made aware of. In terms of contraindications, lithium cannot be used in an individual who has brain damage. Severe renal insufficiency is an absolute contraindication to lithium. Lower levels of renal insufficiency may also be a contraindication if that specific patient requires a low sodium diet. It is generally contraindicated in individuals who have cardiovascular disease, as well as in individuals who are severely debilitated. In terms of precautions, the first one noted here stems off one of the contraindications, in that good kidney function, salt intake, as well as fluid intake is essential while using lithium. Excessive loss of sodium, which may happen when a patient vomits, could lead to an increase in retention of lithium and put that patient at an increased risk of lithium toxicity. Lower doses of lithium are required in individuals who are on a low salt diet. Heavy sweating can lead to a change in plasma concentrations of lithium. It must be used cautiously and with a lower dose in the elderly population, as they have a decreased ability to excrete lithium. And the last precaution here is that the dose of lithium should not be increased rapidly alongside of an antipsychotic, as it may increase the risk of neurotoxicity. Once somebody is made aware of the precautions and contraindications and they start using lithium, most likely they'll be taking this in capsule form. It's available as a 150, a 300, as well as a 600 milligram capsule. There is a tablet available at 300 milligram strength. There are sustained release tablets that are available as 300 and 450 milligram. And finally, extended release tablets available as 300 milligram. There is actually an oral solution available as well, just as a generic, that comes in at a strength of 300 milligrams per 5 ml. Now, when somebody does start this dose, typically they would start off on a low dose of lithium and increase that dose slowly over time under the guidance of their physician. Different from most medications that we've talked about in other videos, this medication doesn't have a target dose, rather it has a target blood level that must be achieved to achieve the mood stabilization. During acute treatment with lithium, the range of dose can go anywhere from 900 milligrams to 2400 milligrams taken daily. Maintenance therapy is usually about 400 to 1200 milligrams a day. Patients who are in the acute manic state seem to have a higher tolerance to lithium than individuals who are not in that same state. So in these people, you can actually target a higher blood level until they come out of that mania phase and get into remission. If a patient's creatinine clearance was between 10 and 50 mils per min, you would typically only use 50 or 75% of the regular standard dose of lithium. With more severe renal impairment, so creatinine clearance less than 10 mils per min, you would typically only use 25 to 50% of the regular standard dose of lithium. If a patient is using lithium and also undergoing dialysis, they should take their dose of lithium following dialysis. After a patient is stabilized on lithium, the goal would be to have them take their full dose all at once, usually during the night. After a dose of lithium is taken, it typically reaches its peak plasma concentration in about 1 or 2 hours. Now, as with all medication, there are some adverse reactions or side effects that people may experience while using lithium. So I'm going to break those down here for you now. Typically, I would just rhyme off side effects for the medication, but this time I'm going to try to break down the side effects in terms of what part of the body they affect, whether that be cardiovascular or CNS. Now, in terms of CNS side effects, or central nervous system side effects, the first side effect to note here that comes in at 33% is a general feeling of weakness while using lithium. Some people do describe fatigue, drowsiness, that sense of tiredness, while others experience restlessness. Cognitive blunting or memory difficulties can happen in up to 28% of people. Some people notice a lack of drive or creativity. Some individuals may experience slurred speech, and some other people notice tremors. A fine tremor or shakiness can happen up to 65% of the time, but this would usually happen more often in people using a higher dose. Now, in terms of cardiovascular effects, the first one to note here would be bradycardia, or a slow heart rate. 20 to 30% of people will experience a benign T-wave change on the ECG. There could also be some QRS widening. In terms of side effects affecting your endocrine system, clinical hypothyroidism happens in about 34% of people that use lithium long term. Some of them note this happening in the first year. The risk of this would be greater in women who are over the age of 40 who have rapid cycling. And subclinical hypothyroidism happens in about 25% of individuals. Hyperparathyroidism and hyperkalemia were reported in 10 to 40% of people using lithium. This is a concern because it may predispose patients to a decrease in bone density or to cardiac conduction disturbances. 15% of females that use lithium report a prolonged menstrual cycle. Up to 60% of people using lithium may experience some weight gain, but only 25% of people that do gain weight gain over 4 kilograms. In terms of gastrointestinal side effects, 50% of people experience nausea. Vomiting happens in 20% of people, but would be more common if individuals had a higher blood level of lithium. Diarrhea or loose stools happens in 20% of patients. 36% of patients experience excessive thirst, usually in combination with dry mouth. In terms of dermatological effects, some people notice a rash or itchiness when using lithium. Dry skin is common. Some patients' acne may worsen, and others notice that their hair begins to become very dry and thinning. Folliculitis may happen as well, typically in the spring. And finally, I guess we'll make this an others category for side effects. Some people do notice blurred vision with lithium. Up to 10% of patients notice a change in their sexual function. And some people notice edema or swelling of their extremities. That's all we're going to talk about today with lithium, or Carbolith. As always, I'm thankful that you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help me grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. That's it for today. Take care.